Good evening, everybody. Such a great turnout. I'm so excited to be here. My name is Dr. Ken Eagle. I am a chiropractor and a brain core therapy practitioner. And I'm here to talk to you tonight about attention deficit hyperactivity disorder. And this teleseminar is brought to you by Brain Core Therapy of Long Island. And we are just excited to get started to explain what we do and how we can help you and change the lives of you, your loved ones, and your whole family. So let's get started. So attention deficit hyperactivity disorder is currently one of the most common diagnosed conditions in children. Roughly about 10% of kids between the ages of 4 and 17 are being diagnosed with this condition, which is a startling statistic. And what makes it even more startling is that most of these kids are treated with psychoactive drugs, and we're going to talk more about that as we move forward. This behavior disorder emerges typically before the age of 7. Symptoms include inattention, impulsive behavior, and hyperactive behaviors. ADHD is not a reflection of a child's intelligence, nor, it's very important to understand, is it caused by poor parenting. Typically, it's common in people who have close relatives with the condition, so it's not uncommon to have more than one kid in a family suffering from ADHD, and it's also roughly about 2 to 1 boys to about 2 boys to every girl is diagnosed with ADHD. So one of the first questions that people often ask is, what's the difference between ADD and ADHD? A lot of us are more familiar with the term ADD, but the current Diagnostic and Statistical Manual of Mental Disorders, which is called the DSM-4 currently, outlines the diagnostic criteria for mental conditions. And although the terms ADD and ADHD are used interchangeably, ADHD is the official name used by the American Psychiatric Association, and it encompasses 3 different types of behaviors: hyperactive behavior, impulsive behavior, and inattentive behaviors. Often these things are one, the other, or combined. ADD is the older term. Thus, in some older literature, you will find that term as a synonym for ADHD. But they, they added the ADHD to encompass the hyperactive part of the disorder. ADHD is a condition that affects not only children but also adolescents and adults. It's one of the most common childhood psychiatric conditions. As I mentioned before, in the United States, the National Institute of Mental Health estimates that 5 million children in the United States have ADHD, which is about 5% of all children. And as I mentioned earlier, about 10% of children between the ages of 4 and 17. And studies show that up to 70% of children with ADHD actually continue to have symptoms into adulthood. Childhood ADHD is diagnosed after a child has shown 6 or more specific symptoms of inactivity and or hyperactivity on a regular basis for more than 6 months in more than 2 settings. There is no single test for ADHD, and it's usually diagnosed based on a set of questionnaires. A doctor can diagnose ADHD with the help of standard guidelines. The diagnosis of ADHD involves the gathering of information from several sources, including schools, caregivers, parents, teachers. The doctor will consider how a child's behavior compares with that of other children of roughly the same age. Doctors may classify symptoms as the following types of ADHD. Combined type, which is inattentive and hyperactive and compulsive, all 3 combined. Children with this type of ADHD show all 3 symptoms. This is the most common form of ADHD. Another type is just the hyperactive impulsive type. Children show both hyperactive and impulsive behavior but are able to pay attention. Then there's the third type, which is the inattentive type, formerly known as attention deficit disorder, ADD. These children are not overly active. They do not disrupt classrooms or other activities, so their symptoms, often are overlooked. Typically diagnosed in childhood, ADHD still affects many teens. The symptoms, inattention, impulsivity, and hyperactivity, are intrusive, which means they interrupt and seriously interfere with a teen's life. During teen years, especially as the hormonal changes of adolescence are going on, symptoms of ADHD may actually intensify. Teens with ADHD may also be fidgety and have a difficult time sitting still in class. Often teens with attention deficit hyperactive disorder are so busy focusing on other things they forget about the task at hand. This can be seen especially with homework and athletic skills, and even in relationships with their peers. This lack of attention to what they're doing often leads to poor performance on tests and being rejected from sports teams, extracurricular activities, and peer groups. Alarmingly, teens with ADHD are more likely to be heavy drinkers than teens without this condition. They are also more likely to have problems with drinking. In clinical studies, research confirmed that teens with ADHD were twice as likely to have abused alcohol within the past 6 months. They also found that teens with ADHD were likely to abuse drugs and 3 times more likely to abuse drugs other than marijuana. So they're more likely to try things other than marijuana. Getting proper treatment for ADHD in teens may cut the risk of later alcohol and drug abuse. As far as adults with ADHD, many have difficulty following directions, remembering information, concentrating, organizing tasks, or completing work within time limits. If these difficulties are not managed appropriately, they can cause associated behavioral, emotional, social, vocational, and even academic problems. The following behaviors and problems may stem directly from ADHD or may be the result of related difficulties. Just to run through the list: chronic lateness and forgetfulness, anxiety, low self-esteem, employment problems, difficulty controlling anger, impulsiveness, substance abuse or addiction, poor organization skills, procrastination, low frustration tolerance, chronic boredom, difficulty concentrating when reading, mood swings, depression, and relationship problems. These behaviors may be mild to severe and can vary with the situation or be present all the time. Some adults with ADHD may be able to concentrate if they are interested or excited about what they're doing. Others may have difficulty focusing under any circumstances. Some adults look for stimulation, but others avoid it. In addition, adults with ADHD can be withdrawn and antisocial, or they can be overly social and unable to be alone. They are more likely to change employers frequently and perform poorly, have had fewer occupational achievements, have a lower socioeconomic status, have driving violations such as being cited for speeding, having their licenses suspended, be involved in more crashes, rate themselves and others as using poor driving habits. In addition, adults with ADHD are more likely to use illegal substances more frequently, smoke cigarettes, self-report psychological maladjustment more often, have more marital problems and multiple marriages, have higher incidence of separation and divorce. Much of this functional impairment diminishes with remission of the disorder and can be mitigated by appropriate treatment. I want to just run down a list of some common conditions that coexist with ADHD, and these cover the spectrum of children, adolescents, and adults. They're not present in each one, but to some degree they can be present in every category. There's learning disorders, anxiety and depression, bipolar disorder, oppositional defiance disorder, conduct disorder, Tourette syndrome, substance abuse, obsessive compulsive disorder, intermittent explosive disorder, panic disorder, and specific phobias. A class of drugs called psychostimulants or stimulants have been used to effectively treat ADHD for years. They work by increasing the production of two neurotransmitters, dopamine and norepinephrine. These medications help users to focus their thoughts and ignore distractions. Stimulant medications are effective in roughly 70 to 80% of patients. However, there are short and long-term effects related to these drugs. Stimulant drugs to treat ADHD include Adderall, Concerta, Dexedrine, Focalin, Metadate, Methylene, Ritalin, and Desoxin, just to name a couple. ADHD drugs sometimes have side effects. The most common side effects of ADHD drugs include decreased appetite or weight loss, sleep problems, headaches, jitteriness, social withdrawal, and stomach aches. On rare occasions, medications can cause more serious side effects. For instance, some stimulants are associated with an increased risk of cardiovascular problems and even sudden death. And they may also exacerbate psychiatric conditions like depression or anxiety. There are some stimulant safety concerns. The long-term impact of ADHD medication on the youthful developing brain is not yet known. And some researchers are concerned that the use of drugs such as Ritalin in children and teens might interfere with normal brain development. There are also heart-related concerns. ADHD stimulant medications have been found to cause sudden death in children and adults with heart conditions. The American Association recommends that all individuals, including children, have a cardiac evaluation prior to starting a stimulant, and an electrocardiograph is recommended if the person has a history of heart problems. In addition to the heart problems, there are psychiatric concerns. Stimulants can trigger or exacerbate symptoms of hostility, aggression, anxiety, depression, and even paranoia. People with a personal or family history of suicide, depression, or bipolar disorder are at a particularly high risk and should be carefully monitored when taking stimulants. Stimulant abuse has become a growing problem, particularly among teens and young adults. College students take them for a boost when cramming for exams or pulling all-nighters. Others abuse stimulant meds for their weight loss properties. If a child is taking stimulants, we need to make sure that they aren't sharing the pills or selling them, because that's also a big concern. ADHD stimulants are not recommended for those with any type of heart defect or heart disease, people with high blood pressure, hyperthyroidism, glaucoma, high levels of anxiety, or any history of drug abuse. So let's talk about attention deficit hyperactive disorder and brain core therapy, or specifically brain core neurofeedback therapy, because that's what brain core therapy is. It's a form of neurofeedback. So, brain core neurofeedback, what is it used for? Just to give a little bit of